This is Leah. She came to Korea for FFS surgery.
You're filming too?
Yeah.
Yeah, stop doing the peace sign every time someone puts a camera on. Hi, Almost. Stop doing that.
Hi, my name is Eleanor Bateman. I go by Elba and I'm a content creator from the UK. I'm here today with Docfinderkorea to get my sister her facial feminization surgery. I'm really excited. How are you doing?
Hi, so today's my surgery day. I've just woken up and I'm absolutely starving, really thirsty, but excited to get going and see what the day entails. Yeah, I'm super nervous, excited to get underway and excited to see the results. A little bit apprehensive, to be honest, but excited to get it over and done with. Hi, I'm Leah. I'm here at Nana today for my consultation. Just about to head in now, so excited.
So what are your, complexes that you had?
I think the biggest one is probably my nose bridge. I've got quite a hump on the top of the bridge and I just sort of like to get that reduced. Maybe get my nose turned up a little bit at the end as well. And then my jawline as well is quite blocky and quite square, so I quite like to get that adjusted as well.
So do you have any kind of expected image that you have after the surgery?
Not really, no. I just think I'd like to look different, obviously, but sort of just more like the person that I think I am. I think the person that I see in the mirror is the ideal image that I'm going for.
Look at your CT scan first. That's scary. Later. Hold it up yourself.
코부터 보면
So you do have a hump in the bridge. And then your nasal bone itself is a little white. And then your nose tip is a little bit bulbous, also with droopy. So we're gonna remove the hump on your bridge. So we're gonna bring up the nose tip a little upright. But then when we bring up the nose tip a little upright, there's like this bend of the nose bridge there, right? But with that, we're gonna maybe use your ear cartilage or your septal cartilage to fill it up to make a straight type of nose bridge, right? So for your nose, you can think of it as a hump removal on your bridge and an osteotomy to narrow down the bridge, and then tiplasty.
건강이 좀 사실 아주 크진 않아요. 아직 크진 않은데.
So he's saying that as for your facial contouring, your bone itself, structure itself is not that big, but then because you don't have that much of a facial, fat, your bones are looking more visible, more kind of thorough. And then you do have a bit of asymmetry on your chin. The right side is, drooping a little bit to the down, falling in a little bit. You see the nose on the CT scan? That's your chin falling down a little bit, especially on the right side. So he's saying that with the jawline, it will be better to do the genial, the front chin as well. He wants to bring it up a little bit.
보면 여기가 더 이렇게 내려와 있잖아요. 그렇죠?
So the right side is falling down a little more, right?
일배로 이렇게 이제 이 부분을 이제 잘라낼 거예요. 잘라내고.
So he's gonna cut off that side, that little thing, to make it even.
잘라서 이렇게 이제 앞으로 빼줄 거고.
And then make the front chin come out a little bit, right? That's the square angle. So the line that he's drawing is the new line that we were gonna add. Any other questions? Is it? Okay, got it. Then we're gonna see the doctor tomorrow before the surgery too, okay?
Okay. See you tomorrow. Thank you.
Well, he's the doctor Hwang who will be in charge of your surgery today for the breast. So he'll explain further from now on.
You can put your on the other side.
So normally the first thing that has to be considered to choose the size of the breast implant is the width of the breast. In your case, as you are a little bit taller, and then also your chest size is a little bit wider, so it's better for you to go for a little bit bigger implant and a wider implant. This would be your minimum size. As in the Korean cup size, it will be a C cup, and then the minimum implant that you can put in is 360. And then if you are not satisfied with this size, if you want to go for a more bigger one, then he can recommend you to consider of 420cc, and then it will give you a D cup size. Obviously, there's a size that's somewhere in between, but this size is the width of the implant is not suitable for you. That's why
okay.
you don't really recommend.
Okay.
So your choice will be either this one or that one.
Oh, okay.
Why don't you try them on?
Yeah, can I try them?
그럼요. 네, 할 수 있는데.
I quite like this size. Yeah,
So you
this
have
size
this-
is quite big. Yeah.
알았어요.
Okay.
사이즈는 이 정도로 하고요.
So you know that for the incision side, you can either choose armpit incision or underneath the breast.
I think armpit incision probably better. Or which one do you think?
It's kind of up to you because you know what is okay. It won't affect results of the surgery, but just that where will be the scar.
How big is it in both cases?
3.5 cm, and then normally for the armpit incision, the scar will be hidden by the one of the wrinkles.
Oh, okay. Maybe armpit then.
Armpit,
Yeah.
okay.
알았어요. 그럼
So for your plan, it would be your implant would be 360 cc, and then your incision is armpit incision. So he's recommending it to go for the Motiva implant. That's one, because as you can see, this one has more wrinkle than this one, right?
This is the one I liked more anyway.
Yeah.
Yes.
That's why he's recommending it to do this.
알겠습니다.
Okay, that will be your surgery plan, and he will do his best to make your boob pretty.
감사합니다.
네, 감사합니다.
Okay.
그러면 수술방에서 금방 뵙도록 하겠습니다.
So he will see you in the OR.
감사합니다.
감사합니다.
So I just got done with my consultation. I'm coming back for surgery tomorrow, so see you tomorrow, I guess. Hi, so today's my surgery day. Super nervous, but also super excited. Just mainly looking forward to seeing the results and being able to drink something again.
리아 배트맨 씨는 코 수술과 안면 윤곽 수술을 받으실 예정인데요. 코는 이제 매부리가 조금 심하시고 뼈도 넓으시고 코끝은 좀 둥고 좀 처져 있는 느낌이라 매부리를 제거를 하고 코끝을 살짝 올려주고 콧대 있는 부분을 울퉁불퉁 없이 매끈한 라인으로 바꿔줄 예정이고요. 안면 윤곽 같은 경우는 아래 사각턱 있는 부분과 턱끝이 비대칭도 있고 두드러지는 부분도 있어서 이 부분을 조금 더 여성스럽게 부드러운 라인으로 바꿔줄 예정입니다.
오늘 리아 씨는 가슴 확대 수술을 하게 될 건데요. 피부가 조금 얇은 편이시고 유선 조직이 거의 없으시기 때문에 자칫 잘못하다가는 좀 티가 많이 나고 부자연스러운 가슴이 될 수도 있습니다. 그래서 리아님이 갖고 있는 흉곽 크기 그리고 피부 두께에 맞춰서 C컵을 목표로 오늘 수술을 하기로 했습니다. 사이즈는 360cc 모티바 보형물을 기준으로 할 거고요. 그리고 리아님은 흉곽이 넓고 가슴이 벌어진 타입이기 때문에 수술 중에 가슴골을 모으는 데 있어서 좀 신경을 많이 써서 잘 진행을 할 예정입니다.
So I'm all done designing with both of the doctors and about to head into surgery now. So very nervous. And I guess I'll speak to you guys on the other side.
Are you nervous? Yeah.
Just put me to sleep.
Good sleep already. Good. Bye bye. See you later.
Bye, Leah. See you.
Oh, you're shaking. Are you cold?